Good morning. Welcome to the Transitioning Together series. Today we're talking about the transition from youth healthcare to adult Medicaid. To introduce myself, I am Maria Barber, your host. I work with the Nevada Center for Excellence in Disabilities, their Family Navigation Network, where we support families with youth with special healthcare needs to navigate our complex healthcare systems in Nevada. The Family Navigation Network receives support from our funders, Nevada State Department of Health and Human Services, and the Maternal Child Health Bureau. A little bit about me. I've lived in the community for 25 years. I have an 18-year-old daughter with cerebral palsy. And so I am living and breathing transition every day. I know personally how important this period of time is for our families. And over the years, I have come to find that there's just very little support and answers for all of us with all of the intricate things that go into this transition. This is why I have taken on this project to educate families on the transition period for our loved ones so we can all be educated and make the right choices for our families. Today, we're talking about Medicaid transition, moving from youth healthcare or Katie Beckett, same, to adult Medicaid, fee for service. We have 5 specialists from Katie Beckett, Medicaid, and Medicare to answer all of our questions we may have today. So this is an open forum type format. Our speakers will have PowerPoints and be really giving us a lot of information today. If you have a question or a comment or suggestion, please raise your hand or type it in the chat. Kamala is our moderator. She is amazing. She will get your question answered as quickly as possible. And if you have a burning question and you just cannot wait for Kamala, that's okay too. Raise your hand and she'll be able to call on you. Okay, now I would like to introduce our speakers. We know that Medicaid, Medicare, Katie Beckett, youth healthcare is all really tricky to navigate. So everybody has come together today to help us kind of piece all of this together for our loved ones' futures. So first we have Cherie Stagner. She is the Reno Care Coordinator for Medicaid. Janessa Surflatin is the Katie Beckett Billing and Overall Expert. Tanya Blakowiak is the Katie Beckett Supervisor. Sandra Villalbazo Warner is the Social Services Manager. And Vanessa Justice is another Social Services Manager with Welfare. So please help me welcome them, and they will begin for us today.
Thank you, Maria. We'll jump in to the Katie Beckett transition into adulthood. And I'll share my screen here. Hopefully everyone can see it. All right. Everybody, hopefully, thumbs up, Maria. Okay, perfect. All right, so the transition into adulthood after being on Katie Beckett can be kind of ominous and the unknown. So we're here to hopefully help ease that transition today. Some of the things that are important to know is you're eligible for Katie Beckett up until the day of your 19th birthday. Then you're no longer eligible for the Katie Beckett fee for service Medicaid. If you are established with a intermediate care facility, intellectually delayed level of care through a agency such as Sierra Regional Center or Rural Regional Center, then you will continue to have some support throughout the rest of adulthood with your child. and no longer child, I guess, because they're now going to be adults. But beginning their 18th birthday, it's recommended to start going down to the Social Security office and trying to, if they qualify for disability in the Social Security guidelines, getting some Social Security started for them so they can receive income and continue with their fee-for-service Medicaid, ideally. And these kiddos that do qualify after 2 years being on Social Security, they may be eligible for Medicare at that time. If they were, for whatever reasons, on Social Security prior for their childhood, then they would just, on their 18th birthday, I believe, be eligible then for Medicare. If they're not approved for Social Security, then the next step that would be probably good to pursue would be applying with DWSS, which is welfare. And we have attached their website there to start that process. You go onto their website, click on Access Nevada and apply for benefits and see, based on your individual circumstances, if there's any programs you're eligible for. And then welfare evaluates those applications, and some folks might be eligible depending which path for the fee-for-service Medicaid, but some may also be eligible for managed care organizations, also known as MCOs, if they're living in the urban or Clark areas. Sorry, urban Washoe or Clark areas. And some of those MCO companies are Anthem Blue Cross and Blue Shield, Molina, Silver Summit, and United Healthcare. And at the bottom there, you'll notice that if you check out the dhcfp.nv.gov website and go to the members tab and the managed care organizations, you can find out more information about those individual insurance choices. Some transitional resources that might be useful if your kiddo is between the age of 18 and 64 and they're physically disabled. They may be eligible for something that's known as the physically disabled or the PD waiver. That's through the Aging and Disability Services Division. The regional centers is a good option as well if you're not already established with them. You can check out what they have to offer. I do believe they do some sort of case management throughout the entire adulthood. Another one, if your kiddo's on the spectrum or soon to be young adult, they can still try to get some services through ATAP until they're 20 years old. Another resource that might be useful is Access to Healthcare Network. And you can check out all the things that they have to offer. Some contact information that might be beneficial is going to ask questions at the DHCFP, Katie Beckett at dhcfp.nv.gov. We can help with resources. We can help with general questions that you may have if you want to find out more information or think of something after this presentation today that you didn't think of prior. It's a great resource because you'll get a live person instead of waiting on hold by making any phone calls. That might be an extenuating amount of time. Also, if you're curious about some of the rules that govern the Medicaid options, such as Katie Beckett, you can check the MOM chapters of the Medicaid Operation Manual, and that gives everything that's covered and encompassed under what regulations we have to abide by. You can also contact welfare directly in Northern Nevada at 775-684-7200 or Southern Nevada 702-486-1646. And that's keeping it sweet and simple, so there's more time for questions.
Okay, this is Kamala. We have a question in the chat from Jen. Will our current Medicaid coordinator also be able to help us when they turn 18?
If you're referring to Katie Beckett, that is something as long as the child is still eligible for Katie Beckett from 18 You have the assistance of your current Katie Beckett caseworker until your 19th birthday.
Yes, she was referring to Katie Beckett, so thank you.
Yes.
Okay, that was fabulous. Thank you, Cherie. Does anybody else have any questions for Cherie about kind of that transition between, oh,
We have one more in the chat from
Okay.
Christy. Is it harder to transition from another state? They're relocating from New Jersey.
Okay, were they established with a similar program such as Katie Beckett in New Jersey?
Christy, if you're able, you can unmute. If not, just put your answer in the chat and I'll relay it.
Yes, can you hear me?
Yes.
Yes, he currently is on Medicaid, and has an established HMO through the Medicaid system. And he also has Social Security. We are kind of like in that weird transition point where he is not 21, he's 20. So it's like they can't help him because he's not under or over. So I was wondering if it would just be easier to reestablish once I move there, or kind of transfer over. I'm kind of unsure of how that works when it comes to coming from another state.
Well, I'm gonna let Janessa talk because she's a little more of the expert on the other side of Medicaid. But in addition to your question, I think reaching out to ADSD would be a good option for you to research and possibly getting on with that PD waiver, the physically disabled waiver.
hey, Cherie, can you explain what ADSD is? Just because she's coming from out of.
Yes, and so the Aging and Disability Services Division helps. There's a waiver, so it's not exactly like our Katie Beckett, but it's you know, it's got so many slots, and depending on the medical criteria to qualify, they can get assistance. You are eligible then for the same fee-for-service Medicaid. Some of the assistance, they come out and perhaps do like an evaluation in the home to see if there's any needed hours for assistance, maybe with like housekeeping or meals and whatnot, and maybe some personal care services can come in with that. And they get eligible, and then when they're eligible, then there's some process that's facilitated with that division that can help get those supports in the home. But that is a different agency, so we're not necessarily experts on that, but it's a good resource.
Thank you.
From moving from one state to another, and Vanessa, you can chime in too with that, but basically you would need to cancel the Medicaid in the state they're in, and then you would reapply here in Nevada for the Medicaid here. And the Medicaid here in Nevada would start once the Medicaid is closed in New Jersey.
Okay, perfect. Thank you.
Is there anything to bridge that gap in there when it's, so they would have no coverage for a certain period of time between eligibility of the new state? Is that correct?
No, this is Vanessa with Division of Welfare. What happens is that you would notify you are moving or have moved, and usually Medicaid would end that month. You know, if we're in October, right? It would end at the end of the month. And then when you come to Nevada, you apply, even if it's in October, but they already know you have coverage all the way to October, then the services will start in November. Because you'll have a letter showing, okay, the services will end, you know, end of October. Or if it ends end of November, depending on the day you come and apply to the agency or deny, it could be all the way to the following month. It could be this, you know, December, or, you know, so there wouldn't be a gap. As long as you come and apply right away.
Understood. Thank you.
You're
And
welcome.
good morning, this is Sandra. I just had a little note to add on that. Anybody that's moving out of state, we always highly suggest to get everything in order in the current state that you're insured, meaning any medical supplies, any medications, anything like that, get it done in the state that you're currently at, that you're covered in, so that when you do move to another state, you do have, let's say, a good 30 days worth of medications, 30 days worth of supplies, things like that, so that you're not pending another state's eligibility to get your needed medical supplies.
Okay, this is Kamala, and we have a question from Jen in the chat, and she's asking, are there any steps you suggest they take when, like, for example, her son is 11 years old? Is there anything she should be taking note of, or, you know, be doing or getting prepared for? I'm sorry. I wanted to add, just for the people in the chat, when you ask your question, I'll put a check mark, and a thumbs up, so you know I've seen it, and I'll be asking it when there's a pause. Thank you.
I'm not exactly sure what information you're looking for based on the background history. I think there's a lot of variables, and it depends on the diagnosis of the kiddo. So I don't know if that's something you want to.
Well, is there a checklist anywhere? This is Kamala. Is there some kind of checklist? Like, you know, your child has reached double digits now. Here's some things to be thinking about. And I'll let Jen add if there's anything else, but that's my part of the question.
Okay, is this kiddo already on Katie Beckett or?
Yes.
Okay, okay. So as far as a checklist, I think, you know, depending on needs of resources, that would be kind of more or less where it would go, because there's some time before the transition into adulthood. So I don't think there's anything pending at the moment that would be pressing. But if there's certain supports and resources that the family's interested in based on this kiddo's diagnoses and needs, then for sure. If they're on the spectrum and they're needing help with finding therapies, whether it's, you know, some families like the swim therapies, some families like the Nevada Equine therapy program. Some kiddos just need ABA. Some kiddos maybe don't do as well with ABA, so they find just having some occupational therapy is helpful. So it just kind of depends on what the needs are of that kiddo. Some do
yeah,
okay.
She added a little bit more information. He has moderate autism and probably won't be able to live independently.
Okay. So gathering some information over time and seeing how they progress. There's individual preferences for if they want to keep the kiddo at home or if they're hoping for them to have some semi-independent living situation when they're older. There's some resources that can be helpful for that, such as the Center for Independent Living. There's some host homes. So it depends as time progresses what the family's needs are. I don't know if that helps answer that question.
You know, I'm just gonna pop in real quick just on this subject. I have a daughter about to turn 10. And so Jen, who was just asking about this, I think that exactly like Cherie was saying, for me, just these transition subjects that the workshops that have been done so far, we have a summit coming up next year that's going to go over a lot of these topics, but just starting to familiarize with what the living options might look like, because it really is, it's a lot to take in. And you start hearing these terms of host home and what is ICL, what are these, you know, and I think just even starting at this age that you and I are at, I think it's actually great to just start familiarizing, and then your ears are open, your eyes are open over a number of years. But I think our the previous workshops are always good to go back to, and those are recorded, and we could also share some of those.
And this is Sandra again, sorry. Anything with those homes, those ICF homes, that's through the the regional centers. If you're out here in Washoe County, it's the Sierra Regional Centers. I would pick their brains because they handle the ICF homes and the qualifications for those homes, and to see if your child would qualify for those homes.
One more thing I can think of is some families are interested in guardianship, depending on the capacity of the kiddo. Sometimes we worry as parents about, our children getting medically exploited or financially exploited. So those are some things to look into as well, I would say.
Okay. Hey, Maria, I just want, Jen is asking for a clarification question. Will the people who are on this, will they get the invite for that summit that Grace just mentioned? How do they
Yes.
make sure okay. All right,
Everyone who
so-
has registered for any of the workshops starting in January will get the
Okay.
information. It's April 19th, if you want to make a note.
Good, thank you. And then Miriam has a question. She posted in the chat. I'll ask it, and then Miriam can unmute if there's further clarification needed. So, what programs cover equine therapy? Sorry if I slaughtered that.
You can research online the Nevada Equine Association Therapy. I apologize. It's in Carson City, to find out more information. I'm not 100% sure what the application process is. I know they evaluate based on if they think the child is a good fit for their program, because some children might be too intimidated or overstimulated by the size of the animals, and some are maybe not strong enough to maybe get on the animals, like if their core strength isn't strong enough. So I know there's an evaluation process, and Tanya helped me. It's the Nevada Equine Assisted Therapy. So,
So Cherie,
Right.
if I can jump in really quick here. So does that mean if the evaluation shows that this would be supportive for that individual, that there's a program in Medicaid that helps financially support that?
Yes, that was my exact question. That's
I-
exactly what I was asking.
Okay, I feel like through Sierra Regional Center or Rural Regional Center, that's where you find out more, because we don't have necessarily like funding for that through Medicaid, but there is some program through the regional center that can facilitate that if eligible.
Okay,
That's
wonderful. Because
what I was going to add. This is Kamala, Miriam. I know one of my children did the horse therapy, and there's two things. Many of these places have scholarships, and so I didn't pay anything. They just let him attend on a scholarship. But if you're with the regional center, depending on your child's age, under 18, they have access to something called PALCO funds. Those can be used to pay for that if you can't get a scholarship. And you could probably also use some of your respite funds for that, depending on how you arranged them going, whether you were there or not, right? So they definitely, through the regional center, you could figure out a way to have it covered if the place doesn't have a scholarship available.
okay, wonderful. That's good to know, because I'm privately paying right now for services. He totally is able to do that. Equine therapy, so I know he would qualify. I do have two questions that I had prior to this question about equine therapy. We just moved from Washington State 2.5 weeks ago. I did let Medicaid know. He was under Medicaid MCO Molina. He has been for years since he was diagnosed. When I called them, they told me you need to physically move in order for us to end services here and for you to be approved there. I did that, and I've been waiting almost 3 weeks, and I haven't heard anything back about Medicaid being approved here in the state of Nevada. How long should I expect a response? Because I'm waiting for ABA therapy. They're ready to go, but I don't have insurance for him right now.
Hi, this is Vanessa from Welfare. The process for Medicaid is 45 days. So you did submit an application with the Welfare Division here in the state of Nevada?
As the first day I physically moved here. Yes.
Perfect. And it's been 3 weeks.
Yes.
I would check again, but yeah, we do have 45 days. And if it's possibly a Katie Beckett,
I I doubt it. I'm under NCO, and they already said that. Molina said, all you have to do is get Medicaid there, and we'll continue services. So Molina itself is aware of my move, and they said they're just ready for Medicaid to kick in.
Okay, okay. So yeah, I would definitely try to contact the office and see where they're at. Did you receive any documents requesting any verification by any chance?
No, no.
Oh, not yet, okay.
And my second question is, I applied for additional respite services in Washington. However, he was denied based on IQ, no medical need. And I heard that IQ is no longer being taken into account when approving respite services. Is that the case? He's nonverbal autistic, but his IQ is very high.
I think that that is something that's usually facilitated again through the regional centers. That's not something that we have any part in eligibility for. There are some respite services here that you can look into. I think it's still called Rave. It's not Rave anymore. I know they went through a recent change in name. We're looking it up real quick. But they have it's Northern Nevada Family Respite Care.
I just posted in the chat links for
Thank
Eagle
you.
Valley Children's Home, the Family Respite Care, which used to be Rave, and
Yes.
Lifetime of Love Nannies. Those
Thank
three
you.
those are outside of Sierra Region or any regional center. But yeah, definitely, Miriam, ask your coordinator at the regional center and just let them know to put you on the list. If you're getting services there, you're, as far as I know, you're eligible for the respite. So tell them you want it and get on the list.
Okay, I haven't approached the regional centers because that's not something we have in Washington State. So that's
okay.
something I definitely have to do.
Yeah.
Okay.
So Miriam, are you in Northern Nevada?
No, Southern.
Southern Nevada. So the Desert Regional Center, DRC, that's who is going to be kind of ground zero for you for a lot of things and all of these services. Now, it's important to note that the PALCO funds and the respite funds through the regional centers, there is an income cap on that for eligibility for certain DRC services.
Yes.
You know, there still would be, you still will want to be have a DRC coordinator, and there will be certain benefits to that, but depending on income, and I think it's something like 300% of the poverty level. I'm not exactly certain, so don't quote me on that, but you know, we can get you the contacts also for DRC if you need. So I just wanted to interject that. Yes, Miriam, I'll send you an email on Monday.
Thank you so much.
No
I
problem.
appreciate it.
Okay, so I've got a question. Would you all be able to explain, if we're all familiar with youth healthcare insurance or Katie Beckett, what is the difference between fee for service and MCOs, and how does that work? Who makes that choice? You know, kind of, I know I have a little confusion around it because MCOs, I don't know if they're new. Anyway, if that would be lovely to get a little grasp on that.
Yes, and that's why we brought our wonderful Janessa, so she can get into that.
So if they're on like SSI, then they would be still fee for service. If they don't qualify for that SSI, that's when they'll go on an MCO, as long as they live in urban, Washoe, or Clark County. So if they live in a rural area, they'll still be fee for service, whether they're, you know, no matter what plan they have. But with the MCOs, basically the difference between the two is they all cover the same core benefits. The biggest difference is which plan, you know, which provider takes what plan. And the MCOs have additional like some of them you can get like a Costco membership. You can get Visa cards. Like if you do so many care visits, you can get like a like $25 gift card or something like that. So they have extra benefits but it's only each plan does their own extra benefits, and that's only through the plans.
And so basically, if a family does not qualify, or the individual after the age of 19 does not
Yep.
qualify for SSI, then the family selects an MCO plan?
It would be the individual. So depending on who's applying, they can say, you know, if they're not eligible for the SSI, they're going to just go under regular if you want to call it regular Medicaid. They would pick what plan they want. If they don't pick a plan, the computer chooses one for them. And then they do have 90 days to change the plan if they don't like it.
Okay.
And then after that, it's just during our open enrollment, which is once a year.
And,
Then-
the same services come with
Yeah,
the MCOs as the fee for service.
Correct. You still get
Okay.
dental, you still get vision, full medical, pharmacy, all that's the same. It's just certain providers take certain plans. So that's where you're wanting to know, okay, I go to A, B, and C doctors. What plans of Medicaid do they take? So you can make sure you select the correct plan.
Got it.
And
And
I'll add
basic-
something, sorry, about the MCOs. A benefit about the MCOs is that when your child turns 18, and let's say they get on the non-SSI Medicaid, so they don't qualify for SSI, they would be on an MCO. The MCOs provide, I'm going to call it light case management, which means if a kiddo and parents need assistance finding a doctor, getting some sort of services covered, they can call the MCO, and the caseworkers over there will help the families obtain those services. So that is a benefit for a child that is over 18 on an MCO.
Got it. Thank you.
And then to piggyback on that, then if you're over income for SSI and you're over income for the MCOs, that's where Katie Beckett comes in, because it's the payer of last resort. And it's the option for families that are over income and basically don't qualify for any other programs. So you still get the support of the Medicaid insurance without looking at the family's income.
And
So the
is that,
qualifying disability diagnosed is based on the Social Security guidelines of disability.
and that's under the age of 19?
Right.
Okay.
Just to add a little bit more, my kiddo has been in an MCO with Molina for years, decades now at this point. So I'm very familiar with them. They have, if you call the main number, you can request, if your child is autistic, you can request a specific autism caseworker, which will literally is an expert in just autism services. So, and you can call, once you get assigned to that person, you call that person directly, so you don't have to spend 3 hours on the phone. They'll just speak directly to that caseworker.
Thank you, Miriam. That's fabulous.
Okay, this is Kamala. I have a question. I have an 18-year-old who has level 1 autism, and they don't, since they have a high IQ, they don't qualify for pretty much anything except both rehab services. And they had the Medicaid, the non-fee-for-service Medicaid that's through welfare. And something has changed. Got a letter saying they now have fee-for-service Medicaid, and now all of a sudden they're not covering prescriptions that they were covering before. I hope that's not out of context here. They do have this, special needs, but yeah, I'm confused. What's going on here? And I'm in Washoe County. I'm in Reno.
What plan did you?
That's a great question. And actually, I would like to give you more attention and time to that question. So I would encourage you to
Thank you.
reach out to us
Okay.
directly. So you can research
Okay.
that further, because there's a lot of different variables that could be going on.
Okay.
And we could pull up your case separately and just make
okay.
sure we look
Thank
at
you.
it thoroughly and find out
Yeah.
exactly what's going on.
Yeah. Who should I email?
Have you informed the pharmacy that you are now on an MCO, that your kid's on an MCO?
I know that I didn't know that something shifted. I mean, I know I got this letter, but I thought it would just kind of be
Yeah.
this seamless thing because we got a new card and it had all the same numbers on it.
Yeah.
And so, yeah, but the message they were, I'm sorry, I don't want to take up everybody's time. I mean, I
You're
can
good.
follow up
You're good.
afterwards.
If you
That's
wanna
what we're
just,
here for. That's what we're here for.
you can
Um,
email us at that Katie Beckett email, the DHCSP Katie Beckett
Okay,
email.
well, I
because-
mean, I know Tanya through, I
Yeah.
mean, can I just email her and she can get me who I need to?
Either way, yes,
Okay.
that'd be
Yeah.
fine.
Yeah, the pharmacy was like, the code is saying they won't cover it because they need a reauthorization from the doctor. I'm like, that doesn't make any sense. Look at last month, they paid for it. What's
Yeah, the
going on?
doctor would have to because they were authorizing it previously through the fee-for-service Medicaid. So now that there's a new insurance vendor, let's call it, like the MCO that you're assigned to, the doctor would just have to submit all the new authorizations. I'm sorry, all the current insurance prescriptions and all the services
Right,
through the new insurance company, and
Okay.
have the pharmacy still use the same Medicaid billing number, but just bill it through whatever plan they're on, whatever MCO they're on.
well, they did that, but we still got a charge and I had to go ahead and pay for it because they were out of meds by this point because we've been dealing with it for 2 weeks.
Yeah,
So
it's probably the doctor needs to authorize it through the new vendor, the new insurance plan versus fee for
okay.
service. Yeah.
What a mess. Okay, I'll reach out. I'm sorry.
Camila,
I didn't mean, yeah.
Camila, I have a question. What is your MCO? Because I know
I
how
don't
kind of
even
Nevada
know.
pays different services than Molina. In my experience, Molina pays everything and
Okay.
they approve everything, whereas other ones are not as good at approving things.
Yeah, I mean, it was
You can
Anthem
always
Blue
request a
Cross.
change also.
Yeah.
If
Yeah.
you're on a different one that is not Molina, you can always request to be moved to that one.
Thank you for that information, Miriam. I appreciate that.
Not for Northern Nevada. Molina's the worst one for a peer.
Okay, another quick question. Are there any differences when you shift from Katie Beckett, youth Medicaid, to adult Medicaid, and anything a parent needs to do to make that transition seamless?
No, other than the dental. Once
Well-
we're 21.
The shift from Katie Beckett to adulthood is fee-for-service Medicaid. So if you think of Katie Beckett just as we are fee-for-service Medicaid insurance, it is, that type of insurance that transitions if you are eligible for SSI into adulthood, it would be the same. So that transition is pretty smooth. I understand Janessa is saying the dental might change a little bit because there's age criteria.
Once you hit four, no matter what plan you're on, whether it's fee for service or regular, once someone hits 21, it's only emergency dental. So then it only is going to do extractions, dentures, and partials. That's it. Where under 21, it's full dental.
Okay, and there is a dental waiver through the regional center, right?
That's
not,
something
that's-
different.
not through Medicaid. Okay.
It is through Medicaid. It's just for people that have an intellectual disability, strictly.
Okay. So that is through Medicaid, the waiver.
Yes. It's
Okay.
the IDD waiver, intellectually disabled waiver.
Okay, and I know in the spring, I don't know if anything's changed, but they were only accepting 3,000 people onto that waiver. Is that still the same?
I don't know. I that's a whole different program. But there
Okay.
is a email that we can provide for the dental program.
Oh, that would
But
be
I know
great.
that the strict criteria is that they do have to have an intellectual disability. That's their number one criteria.
Okay.
And just to kind of clarify for folks, the fee for service versus the MCO. This is Grace Larkins. I'm here with Maria. Sorry.
Oh, well,
There
hi.
she is. I was just going to say, and I'm no expert on this, but just in case any folks are a little confused by that, from most basic level, basically the fee for service is really only used in the rurals right now, and like the waivers, the disability, the IDD, and Katie Beckett. So those are fee for service, and the gotta wave your arms. Our light went out. And in the northern and southern Nevada, Washoe and Clark County, I believe, is where we is automatically the MCOs. But I believe that's going to be shifting even further to the MCO side between now and 2026, more and more. So just wanted to kind of clarify on those a little bit.
This is Kamala, just some housekeeping here. In the chat, I posted a direct link to the family navigation form. So if you would like some further assistance from us in being connected with resources or information, you just fill that out, and we'll help you out. Either if we serve all of Nevada, so wherever you're at, we've got somebody that can help you. And Hannah, one of our Vegas family navigators, has posted a respite resource for Southern Nevada. Yeah, and I was just going to say on the fee for service, also my 23-year-old who has a mild intellectual disability and level 2 autism has the Medicaid fee for service. I assume nothing's changed with that because of that intellectual disability. I mean, the whole thing is confusing to me, but hers hasn't changed, and she's just on what she's been on since she was 4 or 5. Not Medicare, but Medicaid.
More than likely, that's the eligibility is the intellectually delayed. I mean, it goes by the Social Security guidelines. So all the MCOs are basically, you're not low enough income to qualify when your child is under the age of 18 for Social Security. So then the options become either if your income's in between that MCO option, and then if your income is higher, then the Katie Beckett program becomes kind of the last option.
Great. I was also going to say that we looked into some supports for families to maybe, if you need support filling out Medicaid paperwork, or you wish for some kind of case management in this transition time. We'll type these in the chat also, but Vegas, the Collaboration Center, which I think Grace might have just put in there, they often even have SSI individuals that come on site once a week that can also help with that. Yeah, both. So SSI once a week, and then they have people there who can help you fill out Medicaid paperwork when you're moving into adult Medicaid. Nevada Care Connection is another, and the Jewish community, what is the rest of that name? I'm going to look it up here. It's in Vegas.
Jewish Family Services. Hannah just posted it in the chat.
Thank you, Hannah. Jewish Family Services. They also support filling out Medicaid paperwork and helping with that process. It is a lot, and it can for certain be daunting with everything else we all have on our plates. But those are just a few options that you can reach out to and see what kind of supports they might have.
Yeah, we have several here in Northern Nevada too. I'll post those in the chat as soon as I'm done speaking, but because I always slaughter the name of the one, but yeah, and it depends on the level. Like if your child has complex medical needs, there's even another resource. But if you just need help with the welfare documents, like applying for SNAP or anything, I'll post this all in there, but Black Wall Street is a great organization here in Northern Nevada, and they they help people fill out all of these forms if that's all you need. So I will post those in the chat. I'll hush now.
Never heard of that. Am I unmuted?
The ones that didn't show to the family resource there.
Thank you, Kamala. That's amazing. Vanessa, would you be able to explain a little bit about the PD waiver and the FE, frail and elderly waiver, so people can get an idea of more of the details of the programs if they're not, the loved one is not eligible for SSI or Medicaid, pushing them to the programs in Medicare?
Is that for me or the
Yeah.
other Vanessa? I want to make sure.
No, that was for you.
Okay,
Sorry.
yes. So what happens is, right, when a child becomes an adult, we always, they should apply for the regular medical, adult medical, right? We have a regular medical for ages 19 to 64. If they are not eligible for that program, we would have them at that point go to the exchange and possibly purchase, right? If they don't have, if they're not eligible for whatever reason, if they're working, if they have excess income, that's what we're talking about. Now, if they're not able to be employed because of their disability, of course, go to Social Security, apply for SSI. And I believe when we were talking about the SDI, we're talking about when people, of course, when they turn 64. Now there's another program we have, and that's the Medical for Aged, Blind, and Disabled, the MABIT program. So that would be Medicare through the Social Security office for anyone that's turning 65 and older. I know that, a lot of our children are not there yet right now, but that program is available through our agency. And if you guys know of anybody, that's turning 65, they had regular medical, they no longer have the medical, have them apply for the Medicare and also have them apply with us as well, because we may be able to help them pay co-payments and deductibles. Did I answer your question?
Yes, and the PD waiver is specifically for physically disabled.
I'm sorry, PD waiver? What?
And the PD waiver is specifically for physical disabilities, correct?
Correct.
Okay, thank you,
Correct.
Sandra.
Yes.
Okay. Okay, and then that's not through Medicare. That's through you, Sandra, at Medicaid?
It's actually through the Division of Aging and Disability. It's still
Okay.
a state agency, and they call that a waiver program. So
Okay.
it allows, if they meet the criteria, it allows them to get full Medicaid, and it would be fee-for-service Medicaid.
Okay, and if a family is confused about all of this, their regional center coordinator should be able to assist them for, if they get to this point where they
Yes,
need.
to assist, yes. And then what I would do is just guide them to the actual aging and disability office, and they
Okay.
have representatives there that can help with, the application process and getting through the slots, because the waivers are a little bit different. And again, I don't work for aging and disability, but they have allotted slots. So let's just say, and I'm completely guessing, let's just say there's 100 slots. If those slots are filled, then somebody would have to get off the program for, the next person to be eligible. So,
Okay.
I don't know if there's a wait list right now. I don't think there is. I haven't heard that there is a wait list, but that can change tomorrow,
Mm-hmm. Okay, that's great information. There are so many different silos, knowing where to go and what connects and is really helpful.
Sandra, may I ask what services would I be able to get from the Disability and Aging Agency? Because that's the one in Washington State that actually regulates respite care and everything relating to disability. So I'm confused that there's so many here in Nevada. I'm like, where should I go?
Yeah, no worries, no worries. Yeah, coming to a new state, especially Nevada, it's different. It's a different process. Aging and disability waiver, I'm gonna say, is kind of an enhancement to Medicaid, just because they offer extra, I'm gonna say, bells and whistles. For example, if your child gets on the PD waiver here in Nevada, they get a case manager, They get extra services like Cope Pass, which is like homemaking services. Um, they do, they do a lifeline. So in case anybody is like a fall risk or, you know, just needs a little bit of extra assistance, they get a lifeline, that little necklace in case somebody falls. They press it, an ambulance is, you know, will come to the home. So aging and disability, they are a great resource when your kid ages out because they help adults with medical assistance. And if your kiddo gets on the waiver, they will have a case manager, which I know is really important to families to help with this navigation process.
Okay, thank you for clarifying that, because in Washington, actual kids benefit more from the disability department than adults do. So it's good to know that
Oh,
here is the opposite.
okay.
Anything that Vanessa, Cherie, Tanya, Janessa, Sandra, you think we've kind of missed in this this process that we're trying to explain and help assist with?
No, my recommendation, this is Sandra, my recommendation would be just to apply for everything, honestly. If this network, this meeting that we're doing, I feel is an excellent starting point. You know, it's the meeting of the minds, of the great minds, and just throwing out all these resources and possible programs. I would just apply for anything and see if something hits, honestly. There's going to be a program out there to fit your kids' needs when they do, you know, turn into adulthood. If the kiddo is pretty high functioning and may not need a lot of services when they're older, then that would be more of a regular Medicaid through the welfare office as possibly like a childless adult, to where, let's say if they have a little part-time job, they can still qualify for Medicaid based on low income and other criteria. My recommendation would just be apply and see what sticks. Apply for everything and see what sticks.
This is Kamala. I want to second that, Sandra, as a mom of 2 kiddos. Throughout the process, that's been the way I've done it. And asking for, I mean, things that you're like, you don't even know if it's something, just ask for it. Just fill out the stuff, ask for whatever it is you need, because the answer is going to be no always if you don't do that. And I have found that to be very beneficial throughout this journey, with mine being 18 and 23 now. So yes to that, Sandra.
Thank you.
I have a question regarding AAC devices. In Washington State, if you're still under the school system, which is up to the age of 21, you still get Medicaid services paying for AAC devices. Is that the case here in Nevada?
This is Kamala. The school district, if they're in the school district, they pay for it. You know, Lillian had one when she was in the system, and it was paid for by the school.
In
Does
Washington
anybody else?
State, if you are a Medicaid recipient, they take your insurance, and that's how they pay for services.
Yeah, they used Medicaid to pay for it. The school did. I'm
Right,
remembering now.
And my question is 21 still the limit for that, or is there any other?
It's 22 here
limit?
in our state, isn't it? Does anybody know for sure?
It's
Yes.
22.
Okay.
Yeah.
Good to know. Thank you.
Hi there. I've got a couple of things. Miriam, here through NCED, the Nevada Center for Excellence in Disabilities, where we work, we have a program, NATRC, that's the Nevada Assisted Technology. I just put a link in the chat. It's the Nevada Assistive Technology Resource Center. We have actually they have an office in Southern Nevada. I just got to go tour it last month. There's a lot of the technology right there on site that you can see and try. It's really neat. So I would reach out to them. And then I do have a question speaking to the topic we were just on. And it'll come back to me.
Okay, while you're thinking of that, Grace, I'm going to add that I did, when Lillian was young, we did go to what you just posted, the center that's part of INSEAD where I work now, and borrowed a device. So you can check devices out and borrow them to see if they're going to work for your child. But that was before, we were using the iPhones for all of this stuff. So, but I'm sure that, they're very helpful. They, you don't buy anything from them, or they don't help with, getting stuff, but you can go in and look at everything and check it out, or I'm not sure what their term is, but yeah, so I found that effective too. Thanks for bringing that up, Grace.
Yeah, and my question was probably for Sandra, is there a medical portal? I know there was the Katie Beckett website and portal, I believe, are still kind of under construction. Our Medicaid portal, Access Nevada, where might those be sitting? For example, for Miriam, would she possibly be able to go on to Access Nevada? I'm not sure actually if she applied with actual.
That is how I actually applied through Access Nevada.
Okay.
And I keep checking the system and it doesn't say anything. Even though it tells me you can check your status here, there's nowhere where it says what the status is of my application.
Gotcha.
And then I tried calling on Friday, and after 4 hours of waiting, I hang up because I tried to call the office directly, and it was like I couldn't get through it that entire morning.
Wow. Is the Medicaid portal that I hear of, is that different than Access Nevada?
Real quick, Miriam, if you want to email us at the Katie Beckett DHCFP email, we can look into that for you and see if there's any notes in the system, okay?
Thank you. Can you put the link? Wait, what's this? Hannah, is that what Sandra's talking about? The link?
That's good. Oh, that's
while you guys are looking at that, Hannah, I just want to say that Hannah has posted a link for our family navigation form again, and she says that she works closely in Vegas with the NATRC. So she just encourages anyone to fill that form out so she can help you out with that. Oh, here's the email. It was just posted. Sherry posted that email for anyone who needs to follow up with specific questions and assistance in regards to your situation. Thank you, Sherry.
Sure.
So here at the Family Navigation Network, we've heard a little bit about this Medicaid portal that we should be accessing regularly to just check on our status of anything, or medical payments or whatever. How do we do that? Is that something that's active?
Are you referring to the Medicaid app, the Medicaid application, like an app that you download on your phone to see claims and medical history? Is that what we're talking
maybe
to?
The term that we keep hearing is Medicaid portal, but maybe that is what we were referring to, Sandra.
In my mind, a Medicaid portal is for the providers to bill.
Oh,
so
okay.
But I'm guessing maybe you guys are referring to we have a new, well, not new, it's a couple years old, a Medicaid app that parents can download. And Janessa, correct me if I'm wrong, isn't that until it's only eligible for people over 18?
It's 18 and over. So if the child is under 18, you're not gonna be able to use the app.
Okay.
So basically the Access Nevada is a welfare system where you apply for benefits, if you want to make changes to your
Ah,
Medicaid case, if you, to renew the Medicaid, all of that is through Access Nevada. Once you log in, you do have to link it. So you would need to have a little bit more information. You should have your UPI, which when you get your, letters from welfare, it's the case number, is that UPI number. And then you're gonna need your VRU PIN, which you should have gotten when you first got approved. If not, you can always either contact welfare, or if you email us at that Katie Beckett, we can always look that up and give you that VRU PIN number or UPI if you do need it. Because
oh,
you do have to link your account with the Access Nevada so that you can go in there to look up, but it's only going to be on the welfare side. So it doesn't do claims, it doesn't do that. It just says if you're approved for Medicaid or anything like that, or anything with welfare.
Yes, thank you, Janessa. Yes, and there's also now a phone app. Now you can get alerts if your RD is going to be due, or something's changing, or if you need to submit something. So yeah, that's the Access Nevada, and it's only through us, and that's through the dwss.mv.gov. That's how you can apply for any of our programs as well.
will you repeat that website? Sorry,
Yeah, I'll put it in the chat if that's okay.
that's great.
I just posted the link to the app because actually that letter that I was referencing, it says use the Nevada Medicaid app to access your digital Medicaid card, search for providers, view claims, and receive broadcast messages. And so that is the link that is on this letter that I received. So is that sounding correct?
Yes, you have a digital card on the app for the person that you registered. So you can look that up, but like I said, it is only for 18 and over. So if the child is under 18, you're not going to be able to use that app.
This is super great information, from the Medicaid app to the Access Nevada, and it's really helpful to know just how to navigate this all. We have any other questions? Anyone is burning questions, dying to ask? We've got all the key players right here. Okay. Vanessa, I had one more question about the MABID program. Is that program also, you have to be 18 to be eligible? Is that correct? Or is that an aging?
So there's two eligibility, is the SSI. If you have SSI, it could be any age. It could be from birth to whenever. And if you have Social Security, if you're receiving Social Security, even $1 in Social Security, they could be eligible for a full medical under the Medical for Aged, Blind, and Disabled program, the MABID program. So there's a couple categories. And so and so then we have, of course, the elderly, but right now we want to focus on the young ones. So yes, if you have Social Security, I don't know if, and I could be wrong, but if a child receives Medicare for whatever reason, maybe through the parent, I'm not sure how that works. It's not Social Security, not us. But if they were to receive both, and again, if they get $1 at minimum in SSI, you got to come and apply with us because they will get the full medical under that MABID program.
Oh, that's fabulous.
Yep.
Okay. Well, if no one has any other questions and the speakers feel like we've gotten all the information that can support
I'll ask a question. Yeah,
good.
I'll ask one question. Yeah, so my 18-year-old who has the Medicaid through welfare, at what point will that end, or will that shift, or what happens? I mean, because they're considered an adult, but it seems like within that system, they're still considered my child with the mailings that I'm getting and stuff. So how does that work?
How old is your child, Camila?
They're 18. And they have level 1 autism and some other things, but they don't So, they don't qualify for stuff having to do with intellectual disability and all that. So their Medicaid is just the one through the welfare.
Okay, and is that, are they receiving SSI for their
Oh,
disability?
no,
Oh,
no.
they do not.
They
Okay.
have a really high IQ. No, I actually just had the Social Security hearing last week for that. It took 3 years for that to happen, but yeah, I don't know what the outcome is yet. So, yeah, they don't get SSI as far as I know, because I haven't heard back from the judge.
Okay. So right now they're probably under their the regular Medicaid or Magi Medicaid, and that will just have to be renewed once a year for now. And that's the policy right now, and it would be until their age of 64 if nothing changes. Things
Oh.
constantly change, but as of today, 18 to 64, they will have that.
But at some point, it's going to pull away from being in an account with me, right? Like we're both on an account together.
At 19.
Yeah, I was just wondering when it's gonna.
I can answer that for you, Camila. My child is exactly, you're describing my child, highly gifted child. However, he's nonverbal autistic, and he's a soup of autism. Let's just say that. What happens is you can either request to be, once your child is 18, you can allow them to make their own medical decisions on their own. So if that's the case, then they're going to have their own separate account where they're going to be making those decisions on their own. Or if you feel like there's enough reason for you to keep being their what's the word? Their
like their guardian
makes decision for it. Yes.
Yeah.
Then you have to go to
we
court.
decided not to do that. They're
You're
able
gonna
to
have
do that.
separate. Yeah. Once they turn 18, then they'll have their own separate from
So
you.
I guess at some point the Medicaid will catch up and divide us out, because that's what they did with Lillian. She's the 23-year-old, and so we used to all be together. Now she's got her own account, so I assume it'll happen at some point. Yeah. But I'll follow up for more in regards to what's going on with the prescriptions. And then Jen has asked, it's not really related to our conversation, but I want to answer it since we're here. She wants to know how do you know what level of autism your child has? The neuropsychologist who does the assessment will tell you what level it is. Now, if they have an older diagnosis, it's not going to say that, because they just started doing that, I think, about 5 or 6 years ago with the level 1, 2, and 3 autism. So yeah, if you fill out the form, the family navigation form, we can connect you with some neuropsychologists here in Northern Nevada or Southern Nevada who can maybe, they can get that information to you and get an updated diagnosis if you don't already have that. And one more question from Summer. Can you post the information for the Medicaid for adults who Grace may have already done that, who receive $1 or more in SSI that Veronica keeps talking about? Is that what you posted, Grace?
I posted that
okay.
application.
Okay. Yeah, that's actually what my 23-year-old has always had. She's had SSI and Medicaid since she was 5, I think. So, yeah.
And just to go back to that autism question, as far as older diagnoses go, familiar term might be Asperger's, and you could equivalent that to more like the level 1 autism, and anything that's diagnosed beyond that's going to be in the 2 to 3 category to these diagnoses these days.
Absolutely. They stopped using that term because of who it was associated with, but and I don't know, went to the level 1, 2, and 3, and it has to do with levels of support, right? So level 2 support, they need mild supports. Level 3, it's extreme supports. Yeah.
Thank you,
some therapists also do not list the diagnosis level on the report, but you can always call their office and request that one is included in the report. That happened with my child. The psychologist refused to put a label on him just because he's, like I said, all over the place. But I requested that they put an official one on his report just to make it easier for services.
We're caught up with questions in the chat.
Thank you. Miriam just sparked a question for me. From Medicaid approval, when you're filling out an application, are there any things that a family needs to keep in consideration for diagnoses and a kind of a list of things that are important when you're going through this Medicaid process for adult service? I don't know if I'm saying that right, but a list of what the family needs, so there's less confusion. Is there something maybe on a website or something that we could share?
At least for the
Can I jump
welfare
in?
side, at least for the welfare side, you just complete the application if they're over, the age, if they're adults. I mean,
Okay.
and we do the eligibility based on income. So also regular Medicaid is also attached to the IRS filing status. So we do go based on those eligibility, but we don't ask for any, not for regular medical. I don't know on the Medicaid side, we don't do that. Not for regular medical. We just, on
Okay.
the eligibility side, is just based on income. You apply, we look at your income, you're eligible, you're not eligible.
Okay.
Or income or any type of monies, or, it could be Social Security, it could be child support, it could be whatever. We got to take in consideration any type of money coming in for that person.
Okay.
All your medical diagnoses are going to be required when applying for Social Security, for applying for Katie Beckett, applying for the PD waiver, things like that. That's where they're going to need the medical evidence of necessity. And I'm sorry, go ahead, Janessa.
For that question, if the child is considered eligible under their insurance plan through the employer, you can have primary insurance and Medicaid too.
Yes.
To have both Medicaid,
Yes.
which is
Yeah.
payer of last resort. So
Yes. Yeah. For sure. That's Catherine that asked that. And Catherine, I am an example of that. I do have insurance and my role at Family Navigation Network, but I do also qualify for the Medicaid due to my income so it's secondary for myself and my 18-year-old. Now Lillian is separate because she's got the what Grace posted because she's had SSI and Medicaid since she was 4. But if your income, it does not allow you to qualify, then you apply for the Katie Beckett if they're under 18, so that you can have that as the secondary insurance. Did that answer your question, Catherine?
Thank you all. I have one quick question. Thank you. So I'm in that same situation. My daughter has a primary insurance, private, and then Medicaid secondary. And you would think I would know this, but I keep finding myself a little bit confused. If a provider is not a network with her primary insurance, that her secondary Medicaid would then in theory cover that? Or because I thought that I had heard that in order for Medicaid to cover it, it has to at least first be approved in network or approved by your primary. So what happens with that gap there?
You're correct. Medicaid being the payer of last resort is always going to pay only if the primary pays, and it's something that's covered by Medicaid.
So currently my daughter's wheelchair, we've had it for several months, her newest chair, and it went through, all the processes with the DME company and everything else. And then we just got a bill from our private insurance, saying that we owe them $8,000 for that. And so I guess in moving forward, and I'm sorry, I know this isn't directly, but gosh,
No,
I mean,
that's
when
great.
when in Rome, right? I mean, we've got, so, if the primary is not covering it, then does Medicaid pick that up, or what's my next step, you suppose?
It sounds like if they're billing you for the full amount and they haven't billed the primary, they need to bill the primary for you. And then after that, then they would need to submit it to Medicaid. But if
Oh,
you
no,
have
they
a
have-
specific billing question, I encourage you to email us at the Katie Beckett email so we can give you one-on-one support.
I'll do that. Okay, great.
Okay.
Yeah, I know it was definitely first submitted to my private insurance, and it all looked like it was fine and gonna go through, and then bam, they came back for some reason and said no. So yeah, I'll reach out directly. Thank you.
Yeah, that way we can just research and make sure that it's actually been submitted to us and there's nothing going on the back end.
All right, this is Kamala. Let's see, Catherine, looks like she has asked a question. He has always had fee-for-service Medicaid and will now become eligible under my work plan. What if he has just turned 18? And that's going back to the, when we were talking about if they had a primary insurance. Do you guys need clarification? Does that sound?
It wouldn't change anything, even though they turned 18, Medicaid would still be just secondary to the primary insurance.
Yeah, that's the situation I'm in.
Yeah, so whether they have, 18 or, any age, the Medicaid would just be secondary.
I have a question about housing. So what does that look like? How does Medicaid support any kind of living arrangement? Let's say that they're accepted for SSI and they have fee for service Medicaid. How at the age of 24, they want to move out and have an apartment or whatever. What does that look like from Medicaid? Is there any kind of supports there for housing?
So as far as housing is concerned, Medicaid doesn't pay for housing. There is some program through some of the MCOs that has more information for that path of Medicaid. But we would encourage you to look into places, like I had said earlier, the Nevada Center for Independent Living, because they have some case management there and they might have other resources in the way of housing. And I think, Sandra, you were going to say something. Feel free to.
I was just going to say Medicaid does not pay for any sort of housing, only on a certain waivers, like we were talking about, like with the regional centers, they have those ICF homes. But another state resource would be applying for the Reno Housing Authority. I'm assuming it's called maybe Vegas Housing Authority down in Southern Nevada. And I know that out here in Northern Nevada with the Reno Housing Authority, they do give priority to people that are like moms that are pregnant with children, seniors, and people with disabilities. But that's something through the housing authority. Medicaid has nothing to do with housing unless you're on that waiver through the regional centers. And those are their homes, they call them, those ICF homes, which I don't really have too much information on their program, but if you guys are hooked up with the regional centers, definitely pick their brains on how your kiddo can get into some sort of supportive living arrangements when they do age out.
Yeah, on that note, I'm in that situation with my 23-year-old. So if they're over 18, definitely work with the regional center on the shared living provider, that route, if your child is going to be living at home with you, because there is a component of that comes in helping to pay, because they pay you rent essentially, and if you qualify for your income, then you get a portion of that. I mean, it's very confusing, but just make sure that you check with your Sierra Regional Center if they're over 18 and see about becoming their shared living provider. And then that's where you can get some assistance in that regard, as opposed to not having been able to get any assistance up through 18 with caring for them and such. So.
Thank you. That was all really great information.
And I'll also throw this out there. I'm not necessarily a fan of group homes, but there's always group homes that kiddos can get in, which would be like a house with, let's say, 4 or 5 rooms that individuals live there with, I'm going to say minimal support. But there always are those group homes, and that would be self-pay. That has nothing to do with Medicaid or anything like that. But definitely do your research on those group homes is my recommendation.
Yeah. We've got some great resources being posted in the chat. So make sure that you're looking there. And I'm sure Maria's going to include all those resources in the follow-up email. So don't feel like you have to get over there and grab them before they're gone.
Yes, thank you, Kamala. I was just about to say the same thing. I will, in the follow-up email, include all of this that we've talked about. Yeah, I think if no one has any further questions, I think that it's fair to say thank you, guys. Oh gosh, thank you all so much for helping bridge some of these gaps that we've had. I feel like I've had gaps for so many years, and this was so helpful.
Yes, thank you very much.
Yes. So you put those slides up. In order to keep our information relevant for these workshops, because we want to make sure that we're really serving you all, there's a QR code on the screen under the thank you. And that's just a little like 1.5 minute survey. I think it's 5 or 6 questions just to know if we've served you well today or what could have been done differently. And I read all of those, so I take them all into consideration. So please take a minute to scan that QR code if you can. While you're doing that, the last thing I'd like to say is through the Nevada Department of Education, if you happen to be an employee of a Nevada school system, any Nevada school system, I have been allowed to send you a 2.5-hour CEU certificate for any of our workshops. So please send me an email and let me know, and I will get that out to you next week. Oh yeah, I have one more thing to say. Our next workshop is on November 9th, and it is Building Respectful Relationships, a guide to intimacy and personal boundaries. It is a vast wealth of knowledge. We have a doctor speaking to us about these exact things with intellectuals with disabilities, educating the families how to be supportive and understanding, and that relationships don't have to look the same as we expect them to look in our society. We have multiple speakers. I have a panel of individuals who are in relationships, who have disabilities, and their families. So please join us for that. That again is November 9th from 10 to 12:30, same timeline. Thank you all for joining us and taking your time today. I know Saturdays can be difficult, and it's 70 degrees outside here in Northern Nevada anyway. So go enjoy the rest of your weekend, and we hope to see you in November.